Hi, Dr. Rundbaken coming to you from Phoenix, Arizona, Valley of the Spore, if you will. Today I'd like to talk to you about the radiographic findings with valley fever. They're very similar to findings with other pneumonias and other pulmonary problems. You can have patients who develop pulmonary infiltrates, which is a hazy area in the lung that creates a pneumonia. Patients can develop a pulmonary cavity, pleural effusion, where there's fluid outside the lung but within the chest cavity. Some people get valley fever and don't know it, and they can have a residual remnant in their lung called a pulmonary nodule. And often with acute cases of valley fever, where people are profoundly ill, they can develop swollen lymph nodes in the chest we call mediastinal adenopathy or parahilar adenopathy. The lymph nodes often retract and return to normal when the valley fever case resolved. I'd like to show you a case of a patient who has right middle lobe pneumonia. This is indistinguishable from another bacterial pneumonia, but you can see there's a hazy area here in the right middle lobe. This is the patient's right lung, left lung, and the heart shadow here. These pneumonias will clear up and usually leave no remnant, but in about 5% of cases, an individual can develop a pulmonary nodule. This is sort of a tattooing, if you will, of a valley fever case. Typically, I'll follow all pulmonary nodules for 2 years, even if I know them to have had valley fever. On occasion, especially in diabetic patients who develop valley fever, they can get a pulmonary cavity. Here's an individual who has a right upper lobe pulmonary cavity. This patient who has got significant emphysema noted by these hollow cysts throughout the lung fields, a biopsy would need to be considered unless all the symptoms and signs of valley fever are there. In that case, close surveillance would be warranted. If the biopsy is not initially ordered and the lesion grows later, it can be biopsied. In a severely immunosuppressed patient, you can have diffuse infiltrates throughout the lung fields and have what's called multilobar pneumonia. This would be somebody such as a HIV patient that has a very low CD4 count, or a chemotherapeutic patient who's become very severely immunosuppressed and contracted valley fever at the same time.